Greetings, I'm Dr. Winston Carhee. I'm a board member of the Clinical Compass. I am also a past president of the American Black Chiropractic Association, and I am the representative on the Clinical Compass board who is representing the American Black Chiropractic Association. So today, I am presenting this video for your education and entertainment, and we're going to discuss the current updates to the Clinical Compass that have happened here along 2020 and 2021. So first, I'm going to review some updates that occurred in 2020. We have good news, and the Compass is up to good things. Let's discuss a few, shall we? All right. A member of the American Black Chiropractic Association, yours truly, has been added to the Clinical Compass Board of Directors. And so I'm going to help the Clinical Compass and will help the population of the American Black Chiropractic Association know more about the ongoing of the Clinical Compass and to use the Clinical Compass in their practice and to let the students know how they can be involved and what the Clinical Compass is doing for the profession. And then the Clinical Compass and its work were instrumental in reversing restrictive pediatric chiropractic policies that were implemented by Blue Cross Blue Shield of North Dakota. This is an example of our rapid response center where you can use the Clinical Compass if you have some type of obstacle or somebody has been misinterpreting the data, creating unfair policies, then you can contact us. We can help you use the current evidence and literature to help reverse these unfair policies. And this is very important to professional chiropractic. Then we have 2 evidence center updates with a new look and feel. You must check out the Evidence Center. It is phenomenal. It helps practicing chiropractors and their practice and helps their patients. Then we had over 10 state associations have supported as donor organizations, and they've been granted the free access in the Evidence Center. So they've been helping their members by having access to this Evidence Center. We also has increased our social media presence and activity over the last year in 2020 with Amazon Smile and Facebook fundraisers. And we have new research topics that determine conjunction with the Congress, Chiro Congress, and we input the state associations around the nation about the practicing chiropractors who want to have these guidelines produced. We've been communicating with that. And new programs in the works for clinical speakers like myself, who will be presenting to the Georgia Chiropractic Association. A lot of our board members are getting more speaking opportunities to help disseminate the information and talk about the vital importance of the Clinical Compass. And then we are in the process of revising our bylaws. And we did help out with the Carl 2 project. Very important. North Dakota has helped us, and Carl 2 is helping others access to research. So that is some of the highlights that we had in 2020. Now I'll quickly pivot and talk about the highlights we have in 2021. Over the last year, I reviewed all of our findings in our minutes and our notes, and I've come up with a couple of new occurrences in 2020. And I have them categorized in different topics. The first one will be influence. So we're talking about legislation. How do we influence legislation? We are helping our chiropractic profession by writing a letter of support for HR 2654. And this is the Medicare legislation, which is talking about the modernization of Medicare, which basically is allowing practitioners to practice how their practice within their scope in their state and be reimbursed by Medicare. But let's face it, we have a lot of patients come to us with Medicare coverage, but they currently only are considering the chiropractic adjustment, and they reimburse us for that procedure alone, not the consultation, not the x-rays, not the other treatments and modalities, which we know have been proven to work in all the literature, and which we know works clinically. So now we're talking about using our clinical experience. We're talking about using the current research and the patient's want and demand the treatment from us. This is helping us have an evidence-based practice, and it's helping Medicare, right, improve the outcome of their constituents. Next, we are talking about how we help lead the chiropractic profession. We're helping lead the profession by making sure that we are active in the Chiropractic Educational Research Forum. We are help funding this initiative, which is going to help those who are professors in the doctor of chiropractic programs be more engaged in research, learn about research, produce more scholarly articles, and encourage their students to participate in research. This is big. So CIRF is going to be a moving force to increase the amount of research in the chiropractic profession, and we are supporting that, being part of the Clinical Compass. And we're also supporting Forward Thinking Chiropractic Alliance, which has increased the member awareness. And this is something that we are focused on here in 2021. This is part of the December minutes. And we have the Foundation for Chiropractic Progress, which is a very strong organization, I might add, and they're working closely with us to increase the awareness of the Clinical Compass, and by using our social media infos and graphics and working collaboratively to increase the awareness of both of our organizations. Next, we're talking about how we belong, right? And we belong because we have the Evidence Center, which has added about 229 new members. So they have access to our evidence, and they're able to practice better and make sure they're increasing, right, the outcome of the people that they treat, and they're making sure they're using the latest research in case their protocols or procedures are called into question. We are helping the profession doing that. We did that in the first quarter alone. That was part of our April minutes. And now we talk about the different conferences that we're involved in, because we are making sure that the Compass is involved in conferences to make sure that the entire profession is benefiting from clinical research. And the Chiropractic Academy of Research Leadership, Carl, which is one thing that had they had a meeting on March, and that was virtual because of the pandemic. But you simply go to Carl Research Fellows to get more information. There's the website, and also the Association of College of Chiropractic Research Agenda Conference, and that was ACC RAC. It's very important. We were there online March 25th, 27th, and we plan to be there March 17th and 22nd in San Diego. So at Chiro College's ACC RAC conference for more information about that, and that's something you should get involved in. And then we're also part of the WFC, the World Federation of Chiropractic, biannual conferences on research. And so you can find out more about that, but go on to WFC for more information. This was held September 23rd, 25th, and that was virtual. We were a part of that. And we're having one of these conferences will actually be in person. This is the Congress of Chiropractic State Association. This is where all the chiropractic associations come together, and we're talking about how to move the profession forward, and research is top of mind. The Clinical Compass is there. Matter of fact, we were established because of the Chiro Congress, and we will be there in November in Arizona. So look forward to that. Then we help educate. This is what the Clinical Compass does. Talk about evidence, education, and empowerment. This is how we help empower by making sure we're producing scholarly articles. So what have we done? The Clinical Compass papers, we have postpartum and chiropractic paper that was actually published in September. Chiropractic care of adults with postpartum related low back, pelvic girdle, or combination pain, a systematic review. And so we got this paper, I helped get this paper published. And we also are contributing to the publication of research by the neck pain paper submitted for publication. This has been submitted as of January 2021. And then we have a support of the COVID-19 paper for the chiropractic care of COVID-19 in the pandemic era, which was published in April 2020. That was a rapid response to the pandemic that was actually in full swing at that time. All right, we've been active and responsive during the pandemic. And then we have new clinical practice guidelines coming out, best practices for chiropractic management of patients with chronic musculoskeletal pain, and a clinical practice guideline that was also published in October 2020. And then we have the future research papers that we are considering. And a lot of energy is behind dry needling. So this may be one of our next papers. We'll see how this works out. But we know that we are currently in the process of updating the low back pain guidelines, because after 5 years in the research, right, industry, that's considered old. So we must update that, because worst case scenario, third-party administrators could say it's not medically necessary because those guidelines are old. So we give them new guidelines, new literature, new reviews, and we want to update that to make sure they will continue to use and to reimburse you for the services you provide. Okay, very important. We would like your feedback, however. We want to know, right, what the chiropractors in the nation want as far as a research paper that they might find beneficial to help them in practice. Is it evidence information papers on dry needling, or could it be different type of shoulder presentations, or could it be a paper on headache or a paper on concussion that might help you in practice, or would it be a paper about the immune system? Let us know. Give us your feedback, right? Go to clinicalcompass.org, right? Type in a comment, send us an email. You have my personal phone number. Send me a text, call me, and I will relay this information to the board so we can focus on what you feel is most important. All right. So I hope this has been helpful, right? So if you understand the importance of Clinical Compass and you're asking yourself, my goodness, this sounds like a really good organization. How can I get involved? Well, here's how. You simply go to clinicalcompass.org, right? Get online, join our mailing list, right? Click, like, follow, right? On Facebook, LinkedIn, social media, right? Post us there, right? Or you can contact me, right? I'm a board member, right? I'll give you my phone number at the end, and you call me anytime, right? And you know what? You want to get involved in your state association. I'm part of them in Georgia, so I say get involved in the GCA, right? Encourage you to get talk to the board. If your board of your state association is not a member partner with Clinical Compass and that provides information free to their members, then ask your board to become a member partner with the Clinical Compass. And then that grants you access because you're already a member of that state association. That's wonderful. And then you can contact me. I am the ABCA and the GCA rep for the Clinical Compass. So these are ways that you can get involved. All right. So simply, if you want to contact me, here's my phone number here, 445397976. Text me your concerns. Text me if you want to focus on a certain topic for us to produce paper or literature, or text me if you need some evidence to help you fight against these third parties. I will do whatever I can help. That is the mission and purpose of the Clinical Compass. Okay, so hopefully this has been helpful. All right, please, I ask you to help us. Right, this has been the best kept secret in chiropractic. But you know what? Let's get the word out, shall we? Thank you for your time, and thank you for watching this presentation. If I can help in any way, please do not hesitate to call me. Have a great day.